The Chief Operating Officer of the leading medical center in Turkey talks about his education and hospital. He qualified as a medical doctor and general surgeon. This is a three-part video series.
The medical doctor, and my role here in this organization is the CEO. I'm trained in Ankara, University of Gazi, and as a medical doctor. Then I was trained as general surgeon, and after 10 years of clinical practice, I did do my master's degree at the University of Leeds, the UK, and came back, and for the last nine years I'm in private sector, private hospitals, to do management jobs. And Anadolu Foundation is backed by Anadolu Group companies, which is the fourth biggest conglomerate of the country, and there is a social responsibility project of the group, and we are operational for the last 5.5 years. And from the very beginning we are affiliated with Johns Hopkins Medicine, and our relationship consists of education and quality, basically. And we are surveyed and by Johns Hopkins teams twice a year, and action reports, action plans. So we are in touch with the quality, and we have on-site chief nursing officer from Johns Hopkins. We have joint symposiums twice a year with them. We translated Johns Hopkins books in Turkish, so many activities. So our excellence centers are oncology, heart care, orthopedics, advanced laparoscopic surgeries, in vitro fertilization, and dentistry. Oncology, we have the whole spectrum of medical oncology: bone marrow transplantation, radiation therapy, cyberknife, and for monitorization purposes mainly PET-CT. So we have the whole spectrum for oncology. For cardiac care, we have adult and pediatric, invasive, non-invasive cardiology to surgery. So again, we have the whole spectrum for all those. Infection control is a number one topic for us. And the results are very good comparing with national and international benchmarks. And I'll give you an example that we don't have medicine-resistant staph aureus in the hospital yet. So it's good. It's a very good program, surveillance program. We have it accredited by JCI, and the results are very low, very low. And I'm happy that we are in the 6th year and it's still quite successful. So what is more is that we can make benchmarks. One of them is cabbage mortality rate for adults. We have 0.5% mortality rate on average, and comparing with the 2% cardiothoracic surgeons database in the US, it's a successful, very successful rate, really. And another one is the in vitro fertilization program success. Pregnancy rate is 58%. Again, it's significantly higher than the US average, which is 43%. And now our bone marrow program has just started, so I'm not able to give our own numbers, but our team's results for the last 3 years is very successful, and with the help of state-of-the-art infrastructure, we are expecting to get very successful results for bone marrow as well.
Medical Tourism Corporation facilitates affordable medical and dental treatment at world-class international hospitals and clinics. Fill out the estimate request form on our site, medicaltourismco.com, for a free quote.